I am Dr. Sanjay Pandey, consultant urologist at the Kokilaben Dhirubhai Ambani Hospital in Mumbai. Friends, in urology, while we maintain kidney health and look forward to kidney health being maintained all the time, because that is the master of the entire orchestra of the body, it is important for us to be aware of at least one subject which is so common: kidney stones. Kidney stones are common phenomena. They actually are concretions which develop from the solutes that join together within the environment of urine. They are not something which comes as seeds from guava, tomato, and brinjal. So let's not be under the myth that we eat seeds and we form stones. That's not true. The stones form because of concretions joining together as a result of nucleation, aggregation, crystallization, and all this is a common pathway where these can actually become bigger stones. What does it mean? It means that you have got solutes which actually are in the urine as a result of purification of the blood. The kidney purifies the blood and brings about all the solutes, which is excessive material, into the urinary circuit, from where by dissolution and production of urine it comes out into the urine. And what happens if something forms which actually is going to join and nucleate? Have a look at this picture. The kidneys which are at the back have got a small stone out here. So a very small stone in the kidney is a silent phenomenon. It does not come with a noise and does not come with a sound. It is slowly forming there, and that's a lower part of the kidney where a stone is formed. So progressively the stone is gradually growing and getting bigger. What normally happens in a urinary system is urine is produced, and urine is a concentrated liquid where you have got solutes and solvents in a balanced situation. As this happens, urine production which happens comes out through the ureter, a narrow pipe, all the way down into the urinary bladder, from where urine is exited voluntarily. Now look at this picture and understand there's a small stone sitting in the kidney. Either you don't know about it, or you do a health checkup and pick up a small stone in the kidney, or the stone would progressively fall down and create an emergency on the 1st of December or on 15th of August when you are relaxing or you are somewhere in a holiday or in a flight or in a train. So the stone sitting in the kidney can anytime in the urinary drift fall into the kidney pipe and cause a blockage in the urinary pipe. Very important for us to be aware of this. So stone may be silent till the point it is silent, and men can have one or multiple stones in the kidney silently happening. Somebody wakes up to multiple stones in the kidney or a single stone in the kidney when the stone falls down. And as it falls down through this narrow pipe, which is very broad at the top and getting narrower as we go down to the narrowest part and the lower part, things happen. In other words, pain, fever, vomiting, discomfort, progressively getting worse as the stone tries to move down and cannot move down beyond a point in time, gives you a pain or a flank pain or a pain in the side. So sudden onset pain on one side, moving down, coming anteriorly with nausea, vomiting, discomfort, bleeding in urine, one or more of this is a ureteric colic. A colicky pain happening because the ureter is being transgressed by a foreign body which is called a stone. The stone can be very small as 2 millimeters or can be 10 millimeters. It depends on how much amount of it can travel around. So let's move forward from here and go to 3 CT scan reports of 3 patients. Let's look at individual number 1. This stone fell down and came and blocked the upper ureter. So he had a right flank pain. That's the right kidney, that's the left kidney. The stone falls down and actually falls and blocks the urinary passage there. This is the ureter. He may not have any urinary complaints yet because the lower urinary passage is intact. Opposite side kidney is producing urine. But this stone has fallen down. It is actually trying to block the urinary passage and it can choke gradually. So why did this stone only block here? It should have gone down all the way, the narrow passage, and blocked at the narrowest part, or could have gone down the body. It is because the stone is too big or the urinary pipe is too narrow. The normal urinary pipes are all 2 to 4 millimeters, broad at the top as you can see, and as we go down, the pipe turns narrower. This change of the pipe's caliber exactly is like this: broad at the top, narrowest at the bottom. So it turns narrower, narrower and narrowest as it goes down, and the stone has got blocked in the upper ureter. Stones can also get blocked in the mid ureter or the lower ureter. So let's move forward and look at somebody who had a severe pain on the right side overnight, and a small stone has fallen all the way down till the level of the lowermost ureter or the vesico-ureteric junction. So this stone has fallen all the way down and come and block the lower ureter. So again, look at changes which happen about it. So as it comes and gets blocked, pain, fever, nausea, vomiting, but this just moved all the way down. You may have urinary symptoms also. You may have some bleeding in urine also. That's a possibility. Let's move forward and look at somebody else who actually has got a swelling in the kidney called hydronephrosis and a stone blocking the kidney pipe much higher up, as high as the first case. Now this is a very large stone. It's close to a 16 millimeter stone, and the kidney is all swollen compared to a meat looking normal kidney. This is all swollen kidney, which means the kidney pipe is blocked by a stone and the kidney is now ballooned as a result of blockage. And this may not be a day, week or a month phenomenon. This may be long-standing phenomena where the kidney has got thinned out and there is quite a storage issue. So we look at individuals coming with this, the stones have fallen down and given them discomfort. So somebody woke up to a phenomena of stone only when they got the pain, they got the bleeding, they got a discomfort, or they got fever. It's important for us to understand that this is an acute emergency which happens to people who have got stones in the kidney. So if I have got stone in the kidney, my job is to see a urologist in this country. At the Kokilaben Hospital, we see routine patients and we see emergency patients. And that's what we reach every home through this awareness drive and attempt to make you understand that stone formation, once formed, can form again and again. In other simple language, once a stone former, always a stone former, but not to panic. We have got aspects of care where on the one side, we will identify the stone, treat it and cure it because this came with emergency. At the same time, we'll look at preventive aspects. So not that you have removed a stone, you will keep forgetting about it. We'll go to the next level and prevent a stone formation by looking at improvement of things around. The entire aspect has to be governed by metabolism. So for people who will be allowed to drink good amount of water, they ask them to improve their water intake dramatically. After the stones have been removed, the stent has been removed, they looked into lifestyle changes where water intake has to be liberally improved in terms of drinking water before principal meals, morning, afternoon, evening and night, and also when you go to sleep at night. But this is only for people who are non-cardiac and non-nephrology patients allowed to be given excessive water. What does it do? It makes the urine dilute. That means this much amount of sugar can be diluted and dissolved better by looking extra amount of water intake. We also ask individuals who are stone formers, who are calcium oxalate stone formers, to improve their lemon and orange. Lemon, orange and Indian Avla is all that which has got a citrate level. Citrate doesn't allow calcium oxalate to join together. So higher amount of citrate can only be done by putting more amount of lemon and orange in the system, which can be taken if it's available freely 24/7 across seasons around. So improving lemon, improving orange or improving medications which have got citrate content allows the entire aspect of the urinary environment to change. Environment becomes conducive that the calcium oxalate don't join, calcium phosphate don't join. And they don't join, they can get washed off, like it is happening in you and me. We don't have stones in the kidney. We have done our ultrasound and the kidneys look in good health. We produce good urine, there's no foul smelling and we're happy about it. The job of a urologist is to safeguard urinary health by making you aware of this. So if there's a stone in the kidney, you will not wait. Why? There are two natural histories for a stone. Either the stone will gradually grow and become bigger in the kidney, may not trouble you, may not pain you, or the stone will fall down one sudden moment, which could be left side or right side or both sides. You're sitting in Vapi or in Gujarat or in Jammu Kashmir or in Kolkata, you suddenly have a pain on one side. The pain is accompanied by nausea, vomiting, discomfort is increasing and you are in trouble. You go to emergency department, they take care of your symptomatic care, they do a sonography or a CT scan and pick up a stone. The stone is not in the kidney anymore, the stone is moved out. It is moved into that narrow pipe from where either it has to come out or we need to remove it. And therefore a urologist's job today is to reach the society, to make you aware that if a stone is in the kidney, it can be treated today. Today we can do RIRS or flexible ureteroscopy, where we actually enter the kidney from below and powder these stones and clear them completely. So friends, this is a phenomena where we can do a preventive treatment by preventing stone formation. If stones form, we can treat them in the kidney by lithotripsy or powdering them, and the powder can easily come out, which can be closely watched, observed, monitored or supported by a stent as required. Or individuals who have got a stone in the kidney or multiple small stones, for example a pilot, an air hostess, a marine engineer or a sailor, are in those professions where they handle vehicles or ships or aircraft. In these individuals, if they have got stones and they have got a sudden ureteric colic, then it can be trouble and jeopardy to the vessels and the individuals and the passengers. So these individuals have to be treated and completely cleared of stones. For us, you and me too, if you have got stones in the kidney, we know one day it will become bigger and bigger or it will fall down and trouble us. So why not undergo a treatment? So on one side, undergo a treatment for your kidney stones as decided by the evidence of a CT scan and decided by your urologist in your cities and countries. On the other side, look at prevention of stones. which also means we do a metabolic workup. Metabolism of the body is studied. Whatever is high in the blood will obviously be filtered by your normal kidney and brought in the urine. Whatever is high in the urine will probably nucleate, aggregate and form stones. And therefore, you need to do your job. Improve your water intake, increase your citrate levels by lemon and orange. On the metabolic side, we do evaluations. We want to look at prevention of the next stone. So we study down the metabolic evaluation of blood and urine. We look at serum calcium, phosphorus, uric acid, we look at parathormone, vitamin D3, all those players which are bandmasters of the calcium orchestra, which actually help you to prevent nucleating, aggregating and joining stones together. So identifying a cause of high uric acid, high parathormone could be an end point for us to identify the cause and therefore work on prevention. For those individuals in a metabolic workup, we can't identify the cause. We look at their lifestyle changes, improving their water intake divided across the day and night, look at the lemon orange being increased, do sonographies every year, look at if there is a stone forming. We know it will cause a colic, cause an emergency. We would powder the stone, remove it completely. Other words, keep them stone free and prevent them from stones. So friends, stones cannot be left in the kidney and watched and only being given medications and homeopathics and Ayurvedics with the hope that it will come out. It may come out, but it may be too big by those many years you waited. It may come out and block the urinary passage. Who knows, you could be having only one kidney and that kidney gets blocked. So important for this awareness message to reach everybody that once a stone former, always a stone former. Seeds that you eat, which is lemon, guava, brinjal and lady's finger, don't form stones. It is a myth that you think that stones are formed because of these stuffs. There's a metabolic evaluation which helps us to identify causes in a subset of individuals, and a urologist is interested in your health and your kidneys to prevent the stones from getting lodged, blocked there and left alone, and hoping that by water and by injection therapy we will come out. So we got to look into all these aspects towards not only treatment but a cure and prevention. Friends, urinary stone disease is common. It is very silent phenomena. When it gives you a pain, it's already too late. That means either it's blocked the passage or it's choking something for which you would require an intervention. So for everybody who has not undergone a health checkup, undergo a health checkup. Look at your kidneys, look at the kidney health, look at your creatinine and other values. And if there's a stone, see your urologist. Let him look at the causes of stone formation. Let him look at what is the best approach in observing, treating and curing and intervening as required. Stone treatment has to be done. We cannot leave stones in the kidney and wait for them to create trouble at whatever age we see. Very important for us. Thank you very much.